Good morning, I am Mateu and I would like to present to you this study which deals with the results of Onabotulinumtoxin injection in male patients with Detrusor overactivity after stress urinary incontinence surgery. As Detrusor overactivity may be present in men after stress urinary incontinence surgery, and few studies have assessed the results of Onabotulinumtoxin in this group of patients, our aim was to assess treatment response, complications, and rate of continuation on treatment after this treatment in this specific population. To do so, we conducted a retrospective study of those men with prior stress urinary incontinence surgery who were treated with 100 units of intradetrusor onabotulinumtoxin due to a refractory Detrusor overactivity since 2010 in our department. A rigid cystoscope was used in those patients with no history of artificial urinary sphincter placement, while in patients with artificial urinary sphincter, a flexible cystoscope was used after cuff deflation and deactivation, reactivating the device 12 hours after the procedure. The follow-up consisted in a urodynamic test after 3 months and a clinical visit in which treatment response was assessed according to a treatment benefit scale. Complications were classified according to the Clavian-Dindo classification. Treatment continuation was considered present if, at the last visit, patient had received a onabotulinumtoxin injection within the preceding 12 months. Reasons for discontinuation were also collected, and a comparison between pre- and post-operative urodynamic variables was made. "18 patients were included, with a median age of 71 years. The majority of them had history of radical prostatectomy. 9 patients had an artificial urinary sphincter, while the others had suburethral slings, either adjustable or not, and 7 patients had history of prior radiotherapy. Almost all patients underwent the post-treatment urodynamic test, and the Detrusor overactivity disappeared in almost half of patients. Two-thirds of patients reported improvement after treatment, while no complications related to the previous stress urinary incontinence surgery were detected. However, all patients had discontinued treatment at the end of follow-up, being the efficacy issues the reason for discontinuation in a minority of patients. So, to conclude, intradetrusor onabotulinumtoxin injection may be an effective and safe treatment for male patients with refractory Detrusor overactivity after stress urinary incontinence surgery. However, patients will discontinue treatment due to several reasons. Thank you for your attention.